Hi, my name is Trevor Rickert. I am a PhD candidate in the School of Biological Sciences and a teaching assistant and a research assistant here at Illinois State. I'm also a member of the ISU Graduate Workers Union. It was only last year that ISU campus was the #1 highest number of COVID cases per capita in the nation. I remember being a TA in microbiology and mentoring another undergrad in my laboratory during this time, of which when I was teaching in person, the students in my classroom would have cases, and the student in my lab that I had taught with and been trading tools with hand in hand had also gotten COVID, and we had very close calls a number of times, which to me is very scary because being somebody who is living with another person who is immunocompromised and was more likely to die than to survive if they had gotten COVID was a very scary experience, and being put through that was very dangerous. I remember ISU being late to the game on testing and responding, and when they did, they went with a test that would take too long to be able to catch and quarantine cases before they would spread. Those of us who could do the math in the situation knew that we were in for a bad time, and seeing the previous administration, the Dietz administration, mishandle things as poorly as they did at least made sense then, because the Dietz administration didn't necessarily have epidemiological or biomedical sciences as a guiding principle in their actions. However, I expect that an administration whose leader has a background in biochemistry, molecular biology, and biomedical sciences would have more sound judgment on how to handle this pandemic, especially as we're seeing this Delta variant continue to mutate and spread in another oncoming wave. As we have heard, practically all cases of COVID-19 that result in hospitalization or death are occurring in unvaccinated people. The governor, the Illinois Board of Higher Education, and the Illinois Community College Board are strongly recommending that universities and schools require vaccinations for people taking classes in their institutions. Other public schools in the state are requiring vaccinations, such as Northwestern University, Northern Illinois University, University of Illinois in Chicago, Champaign-Urbana and Carbondale, Loyola University, DePaul University. What model is ISU using that makes it think that continuing to waive protective measures will result in no harm to the university or surrounding community? Or is it that safety is not the highest priority in this case still? I want to believe that this administration is acting in good faith towards the goal of public health and safety. So I do want to hear a good justification as to why ISU believes it does not need to require vaccinations for in-person classes like other universities are doing in order to prevent the spread of the Delta variant of COVID spreading among our community in the coming semester. Thank you very much.
Thank you.